So hello. I really wanted to have a joke to start this session off, but I challenge you, for those playing at home, to go online and find a joke about healthcare reform that's not too politically charged for a conference. I think it's impossible. So I'm going to talk about healthcare reform today. It's a story about technology. It's a story about security. But it's a human story. It's a story about how we interact with healthcare and how that's going to change in 0 to 60 and why. So imagine that you're a patient and you're going into the doctor's office. It's something we all have to do. And you want 3 basic things. You want an ease of experience, you want security, and you want privacy for your data, for the information about you. This has happened to me, maybe it's happened to you. I go into the doctor, they say you have to have a test. I've already had that test 2 weeks ago at a hospital across the town. But they can't trust the results from the other hospital, liability issues and otherwise. So this is an example of inefficiency. And this is not an example of ease of experience. And this is something that would be enhanced by security and by technology, but the incentives aren't there currently. So from the other perspective, as a doctor, I have an office to run. I have staff to manage and staff to be able to have payroll for. I have to be able to pay for this expensive technology equipment that I can perform tests on and keep the upkeep on my office and my establishment. So this is a lot to consider. Additionally, I have to stay in line with regulations like HIPAA or DEA digital rules for healthcare prescribing. It's a big challenge for doctors to keep up with all of this. So less is more. Today, the incentives around the way that hospitals and offices are actually funded are around a pay-per-visit model. So when you go into an office, the doctor is able to collect a fee, and that fee actually goes to fund the office, to fund the equipment, to fund the administration, to fund the overhead. So in fact, the models that we have today, offices are incented to have more visits, more tests, more opportunities to collect a fee to be able to fund their operations. This is all going to change with the Accountable Healthcare, with Affordable Healthcare Act. The Affordable Healthcare Act is going to change the incentives for doctors' offices and healthcare and the way that you experience it as patients and the way that doctors experience it as well exponentially. And the reason is incentive. As part of the Affordable Healthcare Act, there is the Affordable Healthcare Act Innovation Challenge. And what that includes is up to $1 billion in grants and fundings for programs that prove efficiency, cost savings, and delivery of high-quality medical care. This is a huge monetary incentive, and it's going to change the way that hospitals and doctors are incented to do business. At the same time, it's going to allow patients to be able to have shared information, to be able to visit doctors across town, and be able to know that their information is going to be trusted, is going to be secure, and is going to be private. Now that said, there are a couple of examples of these types of organizations and what we can look at in the future. We can look at, for example, accountable care organizations. Now this is kind of an evolution of the HMO, but it actually includes a hospital, a number of staff, and up to 5,000 patients at a minimum. So accountable healthcare organizations are actually going to be accountable for the way that healthcare is delivered to you and that it's delivered securely, efficiently, and with privacy-respecting technologies. On the other side, they're also going to be held to penalties if they don't meet markers for providing benefits at an efficient and a secure and a trustworthy way. So this is a big change in the way that healthcare is going to be affected to you and to I. Now, how can we keep up with all of the regulations and all of the changes and how this is going to be implemented moving forward? We can look at models like Kaiser Permanente, for example. This is one that many of you may be familiar with. I would consider it a healthcare federation or an early accountable care organization. It has 37 hospitals, 17,000 doctors on payroll. That requires highly sophisticated technology with high security, high trust that's also privacy respecting to manage that kind of an operation. So this is the way that technology is going to be moving forward and the way that it's going to be important to us. Also look at things like near-field communications and Internet of Things. The previous talk talked about data being aggregated and being more efficient. So imagine that we're actually taking our tests home with us, getting our blood sugar read by our iPhone. This also has to be secure, efficient, and privacy respecting. So the world's going to move fast in healthcare reform at 0 to 60. The last thing you can do is join associations or trade groups, industry consortia like Kantara Initiative. We help to make sense of where all the technology is going and what you need to be kept abreast of for both your business and your personal lives regarding healthcare security and IT. Thank you.